it's almost been 15 years since we have started the APOE gene journey and story. It was a very interesting happening for me. I was working in primary care medicine, not getting a whole lot of people better, just handing out a lot of medication. And I really was struggling whether I was going to stay in primary care medicine or go out and do something different. I was not sure what I was going to do. And then something very unusual happened. As I was praying about what my career path would take, something happened that was very personal. This program came out of a very personal experience of mine. I had a personal family history of heart disease, but so did my husband. His father died of heart disease when he was 21 years old, and I write about this in the book. Yet he was a very fit person and had very normal cholesterol, with the very common cholesterol test that we do in primary care medicine. Yet he had a very positive heart scan, and this didn't make sense to me. As a primary care provider, I knew that if you had a normal screening cholesterol test, or what I thought that if you had a normal screening cholesterol test, that should not create heart disease. And he had it. So I went off work for almost 3 weeks, and I researched. I gathered as much information as I could, and what I discovered is that 80% of heart disease is genetic. And we have 13 different types of cholesterol, not just two groups. And that the APOE gene is the gene that transports fat and cholesterol in the body, and it is a major component for heart disease prevention or reversal. The APOE gene is the gene that transports fat and cholesterol. We cannot deny that. That is a fundamental fact. And so what we did is we gathered another colleague of mine, I gathered a registered dietitian, and we went to work. We really looked at all the literature, we looked at all the research, and we said, what if we created a gene-supportive environment? And that's what we end up doing almost 15 years later. We have created an APOE gene diet for every APOE genotype that we have. And it works. We've had patients come from all over the world. We've had people show up with very serious chronic illnesses that have completely reversed or have at least taken the edge off of the progression of disease, if not gotten better. And this has happened over and over again. It's like a miracle for me. I have never seen anything quite like it in the almost 35 years that I've been in medicine. And I am so happy that this is working for some people. Like we don't have any other solutions. Some people cannot take medication, and this is the only solution for them. I've had patients that show up who've lived with disease for 50 years, and they've never had an answer, and all of a sudden their disease is gone. I had a 42-year-old woman who had 2 heart attacks, who had stents placed, and within a few years she had her stents removed. Patients over 70 years old with 33 lesions of heart disease, all of a sudden going on the program, doing the program for a couple of years and finding that they only have 11 lesions of heart disease. This is amazing to me. I've never seen anything quite like it. And so I invite you, if you could, think about taking a look at the details of the APOE gene program, and if it looks good to you, come and join us, and we'll make it happen for you also.